across Europe. This work reflects a collaborative effort from multiple member organizations and aims to provide an overview of where we currently stand, as well as the key challenges and opportunities ahead. Okay. To achieve this project, we developed a survey consisting of 19 questions. It was distributed in July 2025 to 38 members organization of the Europe region of World Physiotherapy. We received responses from 33 organizations, which represents a very high response rate of 89%. The data were analyzed in November 2025. This high participation provides a basis to understand the current landscape across Europe. The survey covered 4 main domains. Legislation and advocacy was first, education, clinical practice, and recommendations from member organizations. These domains allow us to capture both structural aspects and future-oriented perspectives. Starting with legislations, we observed significant variability across countries. The first question was whether national legislation recognizes physiotherapy in mental health. The results showed that in many cases, physiotherapy in mental health is not formally recognized as a specialty or defined area of practice. This lack of recognition has important implications for service development, funding, and professional visibility. With regard to the question on whether member organizations have a special interest group, the results were divided. Half of the countries responded that they did, while the other half reported that they did not, around the half of the respondents. Regarding the main challenges that reported were a lack of recognition of role and insufficient funding for physiotherapy in mental health was 2 main responses in this question. When asked about barriers, half of the member organizations said that none existed, while the other half reported that barriers include limited professional recognition due to the lack of legal framework or specialty status, financial barriers from insufficient insurance or public coverage, restricted professional autonomy, require referral or supervision, limited availability of specialized education in mental health physiotherapy, and low visibility and integration within healthcare systems. Okay, at the same time, many countries are actively engaging in advocacy efforts, including policy engagement, active lobbying, and political support, collaborations with universities and health organizations, participation in international networks such as EOPTMH organization, and awareness initiatives through conference and social media. The main areas for developing physiotherapy mental health were improving public awareness of the role and expanding undergraduate and postgraduate training programs. Other areas of development include the physiotherapy role in national guidelines and mental health legislation. And also formalized collaboration within psychiatric and mental health service frameworks, or advocacy for increased funding and resource. And at last, physiotherapy mental health is not being developed in the country, on another question. In terms of education, the results show that a wide range of training programs can be found across many countries. The most common formal training were specialized technical training and undergraduate course was two main responses. However, these programs are often heterogeneous and not necessarily organized as specialized training. The most common competencies were general awareness and basic clinical training. When asked about the resources or training provided by member organizations, 19 countries responded negatively. Of those who responded yes, the support reported included digital courses, webinars, workshops, and national conference. You can see all the map and the responses. In general, the physiotherapists are interested in developing their knowledge of physiotherapy mental health. Only 8 countries report low interest in that field. When asked whether physiotherapy is part of the national standard or clinical guidelines, 24 countries answered yes. However, it's unclear whether physiotherapy mental health is included. The inclusion of physiotherapists in multidisciplinary mental health team is widespread, with 21 of the countries indicating their participation. Of those working in mental health, 78% are employed in psychiatric hospitals, 56% in rehabilitation centers, and 53% in private practice. This is the distribution of the professionals employed. When asked about the population served by physiotherapists working in mental health, the majority of respondents said that it was the adult population, followed by the elderly and children and adolescents. And the recommendations from member organizations can be summarized into 5 key dimensions. Education and training, international training opportunities, specific postgraduate programs. It should be interdisciplinary. Training in cognitive behavior therapy, exercise-based interventions, and trauma-informed approach were identified as a priority. Regarding clinical practice, development of European evidence-based clinical guidelines, strengthening interdisciplinary collaboration, and formally integrating physiotherapists into multidisciplinary mental health teams were also repeatedly identified as essential steps. And regarding professional development, funding opportunities to support projects in this field, also defining core competence advocacy for inclusion in national mental health policies in order to standardize specialized recognition and developing shared outcome measures. Regarding professional promotion and advocacy, inclusion of physiotherapists within national and European mental health strategies, European level awareness campaigns to highlight the role of and impact of physiotherapists in mental health, targeting policymakers, healthcare professionals, and the public, development of information sheets and educational materials, and the last domain was recognition of physiotherapy-specific approach, emphasizing the value of physiotherapy-specific approach such as body-mind interventions, psychomotor physiotherapy, movement-based and body-oriented therapies, economic recognition and reimbursement of these interventions within mental health service were clearly articulated. As with any study, there are limitations to consider of this study. The lack of formal questionnaire validation, the questions were developed by the group and is not validated as a study, as a scientific study, only survey. There may be some response bias by potential sampling. Contextual and generalizability constraints is limited, and the data are self-reported, and this is another limitation of that study. Finally, however, despite this limitation, the study provides valuable insights at a European level. And finally, the recommendations from that study was ministers of health and relevant regulatory bodies should consider establishing formal legal recognition of physiotherapy mental health, either as a statutory specialty or as a clearly defined area of advanced practice. National reimbursements schemes and insurance frameworks should be reviewed to ensure coverage of physiotherapy intervention in mental health settings, including public, private, and community-based service. The development and expansion of dedicated undergraduate and postgraduate training programs in physiotherapy for mental health are essential to ensure a competent and confident workforce. Institutional visibility and policy integration are needed. Collectively, coordinated action at institutional, organizational, educational, and ministerial levels is necessary to address these barriers and to fully realize the potential of physiotherapy in mental health across Europe. And this is all. Here we are all the members of mental health working groups that work in this survey in this term. Thank you for attention.
Thank you very much,